Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
I see with my clear eye. The eye that I cannot be able to use 2 years ago, I use it now to see everything. And I say, may God who make this man have this mind, and all those doctors over here, God will bless them and give them more life.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, what a glorious moment for us to be again in this spiritual edition of You and Your Health. Of course, something is already telling you that something good is happening already in our health system by reason of the knowledge you already acquiring through this program. In addition to that also, you can now slightly, maybe not all the way, but to an extent, start believing that by the year 2025, as we have the vision, that Nigerian life expectancy will never be the same again. And we are optimistically looking forward that by the year 2025, Nigerian life expectancy will be nothing less than 70 years. I have today in this very program to share with you that stroke is not necessarily a disease. Stroke is not a disease. That may really shock you. But I want you to stay tuned. Call your friend to join us now. I'm telling you honestly, just that call can save them a lot. Money, emotional crisis, and order that would have happened as a result of ignorance of what I'm going to share with you now. Do it. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. I'll be your friend, Dr. Richard Okoye, the president of Dr. Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. Today we are discussing the subject of stroke, and I'm here to prove the fact that stroke is not a disease. That stroke is rather an accident, which is 100% preventable. If you can only catch some of the things I will tell you now, you will never have occasion to have stroke, let alone joining those that have made Nigerian life expectancy as low as 55 years. And you know what? It's unfortunate in this side of the world that whenever you see people suddenly slumped, be it as a result of anything that the person couldn't walk again or slumped and died and all that, we normally share a very ugly narrative to that. And that ugly narrative is that somebody somewhere must have been responsible for such ugly scenario. But I tell you, it's not true. Of course, from what you have gotten so far from most of our programs, you got to realize that some of these things happening to our people, it's just simply because we do not know where such is coming from. And today I want to tell you on the subject of stroke. Stroke is not a disease. What do I have to say? It's not a disease. Why people are just bedridden? Yes, stroke is not a disease. Fundamentally, it is called cerebrovascular accident. The word accident means that it is something that suddenly happened, and as a matter of fact, could be prevented. And you don't have to say that someone just got accident. No. Something must have led to the accident. There are 5 different classical signs it will give, even before it happens. I will also show it here. And number 1 is that Stroke is what you know. Of course, there's no explanation to the issue of stroke. What makes people suddenly they will just fall, one leg will go or one hand will go. And you see a very healthy man suddenly be moving. A very healthy man, some time ago, taking care of his family, and all of a sudden, the man became helpless. All of a sudden, the man who cares for his family is now not only being cared for, he's begging for survival. And we have the opportunity, as usual, to show you the physiology of stroke. If you look at me, I'm making these moves. Oh, wonderful. Wow, what a glorious day. Wow, we are doing well. You know who is doing it? It's not this leg that is doing it. What is doing it is my brain. It's my brain that is controlling every... It's my brain that is dancing. It's not this body. Is not. That's why most time when people will have stroke, there will be people who say, no. There's a place. If you just carry the person to that place, the person will start walking. The leg, and they will be doing all manner of things on the leg. The leg, the hand, they are not responsible. They are as good as they used to be. The problem that happened right there in the brain. And I will show you first of all something you need to understand. Have a look at this. Okay. I want you to have a look at this nicely well. All right. This is the brain. And the brain has two parts. I want to first of all explain to you why you hardly see a stroke patient having leg, hand, both sides down at the same time. No. You usually see one leg, one hand, or this side, either it is the right or is that the left. It hardly becomes the two happening same time. I will tell you why. This is the brain, okay? And this is the brain, they are of two equal parts. You have it divided this way. You have the right and the left hemisphere, all right? The right hemisphere and the left hemisphere, there are two different parts. Interestingly, God designed this in this way so that whatever happens to man will not kill him at once, if everything be together, except it happen in a particular region where both of them meet, all right? Now, God made it in such a way that this very part of the brain, as he carries the wire, if you look at it, this very brain, it is this is the brain, and it is these nerves from the spinal cord that actually perform most of these very movements you see me making. All right? So it's the brain that will inform them and say, hey, come on, this very person wants to kick ball. All right? And they will not tell the one on the leg, push him. He will go and kick. Okay. So by this very brain being in two parts, God designed this very brain that the wires, let me use the wire, just get a picture of electrical wiring in the house so you appreciate it nicely. This part of the brain, as it carries the wire that makes those kick, as it's coming down, it moves this way to supply this very part. And this other fellow also carry his own and move this way and supply this one. So, and something happened to the right side, is most likely to knock off this one and knock off the leg. If it happens this place, it's not going to do something about this axis. In most cases, it will carry in wire and knock off this one and this. So that is the reason why you hardly see a stroke patient having both legs, both hands, and everywhere paralyzed. Is that clear to us now? So it is not a poison that made the man, or match a poison and the man couldn't work, or because of somebody that is his enemy in the office who is envious of his promotion and all those nonsense. No.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
In addition to the issue of understanding the anatomy of brain having the right and the left hemisphere, all right? I hope you got that very one right. Good. Now, There's another important thing about this brain. There's a law in it that says, do not whack me. That is to say, everybody that is standing or any structure that is inside the brain, be you blood vessel, be you nerve, be you brain tissue, be you anything, you have to be where you are until they do you part. You don't have opportunity to say you are whacking this person. This very law only gives a window to a neonate. You know, when a baby is born, you usually see that this very place, there seems to be an opening, and it seems as if he's breathing from the head. He's not breathing from the head. I will tell you what's exactly going on right there. What happened is that during this neonatal stage of life, God allowed a space at the middle and a little at the back. This is called anterior frontal. This very anterior frontal, the essence of it during delivery. Okay, you know that the baby has to pass, the head of the baby has to pass through the birth canal of the mother, which in most cases there may be some obstruction, all right? So God created this very anterior frontal and all these very spaces in a situation where there is a need for compromise. The skull can collapse momentarily to enable the baby come out, all right? That is one major advantage that is there for delivery. In addition to that also, the brain of a baby does not finish growing right from birth, all right? It has a period of 9 to 18 months to complete growth. And that very time, that's why this very space is left to enable them to do the necessary adjustment, take your position where you ought to take your position. All right? This will happen, and also by reason of that, a pediatrician now can take advantage to monitor this baby in terms of increase in intracranial pressure, like issue that has to do with diarrhea, having dehydration, or having a meningitis or pressures and all that. So he can also take samples from there. That's a subject for another day. The fact here, as it will be beneficial to us today, is that between 9 and 18 months, these spaces jam, boom, boom. You know what it tells? It is now over. Everybody attention. Stay where you are. Don't whack me because there is no space. It is at this very juncture I will be able to tell you why people do have stroke, or maybe it has a tumor inside that the brain said you ought not to be here. And for you not to be here, I have to show it to everybody that either the leg or something or pressure or headache and all that will happen. So this is very critical. I want you to stay tuned. When I come back now, I will now reveal to you the physiology of stroke. How does stroke occur? Must it be this? Must it be that? If it is a devil, we're going to catch that devil today. Stay tuned. I'll be right back.
I'm more than 50. But God, in His mercy and grace, today I can breastfeed.
I never dreamt in my life to be in India, neither enter plane before I died at the age of 70. My vote of thanks to doctors saving their life. I'm very happy with them. They've not revived my life again, no matter the age. Now I feel I can live a little longer than I could have lived.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. I do hope you're enjoying this very program. This is You and Your Health. This program comes in this very station every Monday by 9:30 a.m. We share a vision that by the year 2025, Nigerian life expectancy, which is currently seated at 55 years, we move to 70 years. Whatever you learn from this program, share it with someone. I got an assignment to decode this medical terminology in a common man's language that by so doing millions of lives can be saved. And that's why I want to encourage you to join us in this campaign. This very program has to be on air. And I want to encourage you in any way you can. You can support us to cause this very program to remain on air. To be here, of course, It's not a poverty-friendly situation. Be that as it may, I want to encourage you. Whatever you have, it can even reach to this very station, and whatever you can, you say, look, I'm putting in for this very program to remain in this very station and even spread to your own community. Together we can make things happen. Together we could be in position to save the life of our people through the power of knowledge. Now today we are looking at the subject of stroke. Very disabling, very frustrating, depression-prone situation. Many people you see very healthy. A man who is hustling, laboring to ensure that his family be in the good condition. All of a sudden one day, they say that, whoa, the man couldn't walk again. The man couldn't go to work again. There's a man with a vision, with a very determination to become, all of a sudden become a beggar. All of a sudden can't help himself, let alone helping others. Most of them goes into depression. A number of them die from that. Some have suffered one stroke, and because they didn't know why the first one happened, it is said, affliction shall not rise the second time. Nevertheless, it is expected of you to know why the first one happened in order to prevent recurrence. Otherwise, hear me, affliction has happened in the life of people over and over again. Some people have had stroke more than once. And you know what? If you have the first stroke, subsequent one will be very close to the grave. And that's one of the things we can't allow to happen. And today I want to review to you, are there types of stroke? Because you can see a situation where somebody say, no, this person was hell and heart, he's not hypertensive, it's not the, how come he has stroke? Yes, it could happen. I will explain to you today. You have two types of stroke. The third one is more or less a T sign. It's called transient ischemic attack. It's different. But these two types of stroke, you have the one that is called hemorrhagic stroke, and you have the one that is called ischemic stroke. With what we have explained so far, you can easily understand why it is so. All right? Now, hemorrhagic stroke is a big grammar, but relax. It is just when it has to do with blood. Hemo is meaning blood. All right? But when it says hemorrhagic, when there is a bursting or bleeding of blood, that's what hemorrhagic stroke, a stroke that is associated or as a result of bleeding, whatever way I will explain to you how it happened. But in this particular case, you can have hemorrhagic stroke, and also you can have another one called ischemic stroke. This one has nothing to do with bleeding, but it's something that causes a place to dry or undergo infarct and all that. All right? Big grammar. But see, I want to show you something here that will help you. Okay. You can see something unique here. This is the brain, all right? Nevertheless, there are networks of blood vessels everywhere. Tiny, tiny ones. And you remember our law? The law states, if this vessel is here, that is your portion for life. You don't have to move. The brain is not expanding. The mind is not growing anymore. So all these things must remain here. All right? Now, something will happen when there is something like high blood pressure. When the pressure increases, all right? All these big ones here can tolerate some level of vessel. But here, number one, there are tiny vessels. Tiny vessels. And at that point, the pressure comes there on the brain. At that time, they will be shouting. Then the person will be having headache will now come. Very severe headache. From there, he said, no, I couldn't sleep in the night. What he's trying to tell you, my friend, do something before something do us. Because the pressure will be there. And because they don't have that much elasticity and elastic strength to be able to withstand the pressure, the blood will just go, at that point, the blood vessel bursts. It will start leaking blood inside the brain. And remember our rule? The rule said there is no space. And it has to come in. And as it's coming in, it will now start by pressure. It will now start pushing some of the brain cells. As it's pushing them, those ones will not receive blood supply. It will not receive issue that has to do with oxygen, and they will start dying and dying and dying. It is at that point, any portion of the brain that got infected, if it is this side, the next one, the person will bossa. It will now fall, the leg can move, the leg can move. If it happens this side, the leg can move, the hand can move, and all of the other things, depending on the location of that bleeding, that will determine whether the person will survive or not survive, or whether the person will recover or not recover. All right? So, an interesting thing here. Now, having noted that, I want you to see another portion also. There could be a scenario like this. Remember, these are blood vessels. The hemorrhagic, we may mention that in a hemorrhagic stroke, this very fellow may have hypertension, all right? Or there's an aneurysm in a rare case. But at this point in time, we have another type of stroke. This type of stroke is called ischemic. What it's trying to say is that there is a block that doesn't allow people to receive what they're supposed to receive, all right? So on that particular occasion, there could be a blood clot coming from a heart disease, coming from obesity, coming from sedentary lifestyle as it were. As you can see, this very clot here is now blocking this very portion. As it blocks this very portion, all of these parts will no longer, parts of the brain will not receive oxygen, will not receive glucose. The next thing that will happen, you can see a scenario like this. Perfect. All right? You can see that that portion of the brain that's supposed to receive blood, receive oxygen, receive all the nucleus, all this portion will die. And as soon as this very portion will die, all the functions they control, functions like all the motor functions, they control speech, all that eye opening and all that. You will hear there, bah. With this understanding, I want to explain something that looks spiritual to you right now. Have you ever seen a situation where you see someone all of a sudden wake up, or in the middle of something, all of a sudden the mouth will move to one side? I don't know what's going on. And in most cases, like one man was told that it's a spirit that slapped him. Yes, we all believe that. Of course, if you see somebody, suddenly the one will go outside. It looks spiritual, all right? So he said there's a spirit that slapped him. But see what happened. This year, the muscles of this year face the suicide. There are nerves that control it and keep them in equal portion. Okay? Two of them are balanced. Balanced in the sense that that very nerve keep them in a way that here and here should be at the center. Okay? In a situation where there is a weakness of this very nerve that control this side, what it means is that this one can balance again, so this other one will drag this one. If it this one that is weak, it will drag this, so the man will just go one side or go this one. So it is a facial nerve problem. That's what it's called, facial nerve palsy, or you call it Bell palsy. It could happen as a result of what could happen. It also could happen as part of transient ischemic attack. And that brings me to the signs you will see. We are establishing here that stroke is an accident. It's not so. If you look at now, we have not really seen this person is healthy until this thing happens. So you cannot say that stroke is a disease. It's not a disease per se. It is a product of a disease which happened as a case of accident. That's why it was called cerebrovascular accident, not a disease as it were. Now, coming to this, before a person will have stroke, any of this could happen. That could also be similar to what happened before somebody has a heart attack. A situation where this person may have any of these 5 classical signs. You will have it even before it happens. Number one is that this very fellow may have some level of weakness. Weakness of the face, or weakness of the hand, or weakness of the leg, on a transit level. That's what I mean. That it could just come and go away. The person may have also a transit speech, difficulty in speech, understanding of speech. It may just happen, it may go away. All right? This fellow may have unusual headache, persistent headache, my friend. That very headache is not the way you used to be. When it happens, quickly look out for the cause. All right? Quickly look out for the cause. And this fellow also could have a situation where there could be numbness or sudden as if you want to fall, or sudden level of blackout. You don't need to rush out at that point. You don't need to even bind and loose Satan or shout. You can take a little calmness at that point, because something is giving you a sign that you need to go out there to find out what is going wrong. Do you understand? So the blurring of the vision could be there, the dizziness, the sudden syncope, as if the person wants to, as if you lose strength or you lose balance. All these things are all signs that may come. And he's telling you, seek for what is going on, either in the heart or look out for what is going on right there also in your blood pressure. Right there also in your heart. All these things are some of the things that could be identified and be avoided. Stay tuned. I will come back. And when I come back, I will tell you the treatment modality. Is there any hope that if somebody has stroke, something can benefit the person instantly? Is it the one you can do even to prevent it? Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
I do hope you are learning a lot from this program. I remain your friend, Dr. Richard Okoye, and today we are discussing something that has to do with stroke, and say the stroke is not a disease, but an accident. Now we are talking about what could anybody do. Number one is that those transit ischemic symptoms or mini stroke, or the signs you can see not so comfortable, you need to go out there to have a proper evaluation. And I will encourage you, if you are hypertensive, don't manage it yourself. Always have a relationship with your doctor. As a matter of fact, doctor quite close to you, so that you people will be in position to manage it. Don't manage BP on your own. Don't manage diabetes on your own. And also, exercise is a very, very beneficial. Very beneficial. Take out time. We have all been always sitting down from morning to night and all that. Take out time. Pick a walk. Walk around. It helps to allow blood flow in your system, not to have a clotting. All right? And you also must do your heart assessment. Get your ECG done. You know, we are having that very campaign. You can also partner with us even to do to your community. We are hopeful that this 2025 vision is alive. And also, in a situation stroke happens, now the treatment of the stroke will be dependent on the type of stroke, whether it's hemorrhagic or whether it's ischemic. And that's why when stroke happens, do not begin to pray first. Even while you are taking the person to the hospital, you can also continue to pray. Because if you have a situation of ischemic stroke in the sense that the gold standard stayed now. If somebody has ischemic stroke, you have injection of tissue plasminogen activator. Once this is available and is given to this very patient, it can blow off the very clots that may be blocking the flow. All right, and this can only happen within 3 hours. That's what they call it, the golden period. Within 3 hours of the stroke happening, if that injection is given, right now the person can recover fully from ischemic attack. And if it is something that has to do with hemorrhagic, now the action and inaction will be determined by the percentage of the area involvement. All right. If it will now require issue of doing a borehole to be able to remove the blood clot and otherwise. But do not go and think somebody is going to perform one miracle somewhere for the leg to start moving. The problem is not the leg, it's not the hand. What happened in the brain.